Hi, this is Karen Magruder, and I made this video to help explain some of the often complex levels of long-term care. I often have students that are confused on the difference between assisted living and nursing facilities and whether hospice is a place or a service and things like that. And so I created this video to explain some of those services that might come up for social workers who are working with older adults or in healthcare. The first thing I want to do is give a little disclaimer that most of what's in here is pretty specific to the state of Texas. There may be some things that are similar in other places, but the services and eligibility and payer source and all of that really varies from state to state. I'm also not going to get extremely into detail with things like how do you qualify. So for example, you have to stay overnight in the hospital for 3 midnights before you can qualify for this service, or the average cost of this is X. Part of it is because there's so much detail with all of that if I went into all of those details, this would be a marathon long video. And secondly, because a lot of that changes as policies or insurance policies change, and also just costs change often. Costs are very variable based on what level of care a person needs. And so that's why I haven't gone into a lot of detail on that, but it'll give you a broad idea of what each of those levels. The aging baby boomer population is booming, that 10,000 Americans are turning 65 every day. Half of the US population is 50 or older, and the population of those age 65 and older is projected to increase 57%. And so there's going to be more and more need as folks are having health issues and growing older for long-term care. In fact, it's estimated that 70% of older Americans will need some form of long-term care throughout their life. Now, I created this graphic to help illustrate some of the different levels of care. Basically, we start off here at the home, and that can be wherever it looks like, right? An apartment, house, whatever, your own home dwelling. The next level up is independent living, that's IL, and then adult day services, assisted living, nursing facilities, long-term acute care hospitals, the hospital, and inpatient hospice. Now, I recognize that this isn't just a really linear process, that some of these might be little steps and some of these might be big steps. Depending on the individual, these might not even necessarily be in the right order in terms of the level of services that are provided or the level of acuity of the problem that there is in needing that level of care, but at least it helps to give you a broad idea of what that looks like. I've circled in the middle assisted living and SNF or nursing facilities because that, in my experience, is usually what people are talking about when they say long-term care. But some of these other services sometimes get lumped into that as well, so I've included them for context. And then these blue kind of plus signs at the bottom here show services that can be provided to a person wherever they are. So companion care, homemaker services, respite care, home health, and hospice might all come to you, whether you live at home or independent living, assisted living, etc. So let's get into each of these in a bit more detail, starting with companion care. There's a great program called Senior Companion Program. It's through Senior Corps, a national community service organization, and they do this free for individuals. But there's also for-profit services that can charge, for providing companion care. And the main focus is usually on social support, socialization, reducing that isolation, but there's often some non-medical assistance as well. Next, we have Homemaker services, and they help with IADLs, instrumental activities of daily living. So that's things like making calls, preparing food, going shopping, light housekeeping, maybe some handling of planning out medications, not administering medications, but planning them out. And these are usually for profit. If it's a formal service, of course, there's neighbors and friends who might help with these things, but I'm talking about a formal service. And often companies that offer homemaker services also offer companion care, home health, and respite. Respite can be provided in the home. So basically, usually it's a informal caregiver, like a family member, who needs a break. Maybe that's just a few hours a week, or maybe that's, they're going to be traveling or something. And so maybe that's home health services coming into the home, or it could also be the older adult or the individual who needs the care going for a short-term stay at a residential facility like an assisted living. Home health, as the name implies, is healthcare provided in the home, wherever that may be. It's a pretty broad range of services. It can be nurses, physical therapy, occupational therapy, a range of different things. And the frequency and duration of the visits varies based on the person's need, as do the costs. The social work role in this is usually doing psychosocial assessments, case management, and helping to refer clients and connect them with resources in the community. Finally, we have hospice, which usually, at least in the area that I'm operating in the Dallas-Fort Worth area, is not a physical place, although there are some inpatient hospice facilities, which is kind of depicted here at the end of this graphic, since usually the person is at the very end of life and needs a pretty high level of care if they're in a residential hospice facility. But more often than not, it's actually just a philosophy or a set of services that travels to the patient wherever they are. They need to have a terminal illness, so a diagnosis where they're expected to live 6 months or less. But if the person lives more than 6 months, they don't just get kicked off. If we think, okay, now they have 6 months, that can be renewed. The focus is palliative or comfort care, and so they're not seeking cures for whatever ailment they have, and it's typically less expensive than aggressive, life-saving, medical treatments. And the goal is to have a better quality of life. It includes an interdisciplinary team, so doctor, nurse, social worker, interfaith chaplain, volunteers. There's a lot of different people that come to the table to rate these wraparounds, biopsychosocial, spiritual services. It also includes the whole family, so they do grief and bereavement work as well. It's increasingly popular, especially among Medicare beneficiaries, and there's a great need for social workers in hospice, particularly master's level social workers, in doing those assessments, care planning, helping the client and their family with end-of-life decision making, grief counseling, that kind of thing. Now we're moving into more facility-based. So independent living has a lot of different names. This is the independent living community where my mom actually lives, and so there's a lot of different names. As you can see, this is a Christian lifestyle community, but there's retirement lifestyle community, active 55 plus communities, independent senior apartments, retirement villas, you name it. Usually those are all sort of basically independent living setups. They can be for-profit or nonprofit, but there's almost always an age restriction. There's not state or federal regulations or oversight. It's more like just independent apartments without any of those, healthcare services. They usually don't include, meals, but they might have a dining area. They might offer, a shuttle, or certainly often social activities. There's often a pretty vibrant social calendar. But it's kind of that in between being in your own home and getting more assisted living services. Now, adult day services are a bit unique because it's not somewhere that you live. Usually you live in maybe your home or independent living or even an assisted living, but visit adult day services during the day. People may call this day hab, adult day, or adult day care. I prefer adult day services. I think that's a bit more dignified terminology for adults. They can be for-profit or nonprofit. Sometimes organizations like the Alzheimer's Association or other groups like that will have programming during the day that kind of functions as adult day services as well. But these facilities usually provide social interaction, therapeutic activities like exercise, meals, and even preventative health services. And these can function to keep people engaged and active, or providing respite care. There's a variety of different reasons that people go to adult day services. Now we're getting into assisted living and nursing facilities. So what is long-term care? Well, the Administration for Community Living says that long-term care is a range of services and supports that you might need to meet your personal care needs. This to me is really broad, and that's not because this is a bad definition. It's just that long-term care is sort of complicated and complex, and as I've mentioned before, it might look different for different people. So this very vague definition, I'm going to try and give you some examples of what that might look like. So what kind of personal care needs are provided in long-term care? That's activities of daily living, or ADLs, sometimes referred to as custodial care. It's things like eating, bathing, getting dressed, going to the restroom, getting from a bed to a wheelchair perhaps, walking around. And so assisted livings provide assistance with those ADLs. Who needs it? I bet you didn't expect to see Beyonce in this lecture on long-term care and older adults. I put that the Alma Single Ladies because the average long-term care resident is a white, single, often widowed female who's over the age of 65. We know that women tend to live longer than men, and so there is a disproportionately high rate of women, and particularly single women, in many of these facilities. As I've mentioned previously, the baby boomer population is aging. Our rates of, our population of older adults is rapidly increasing in the US. We also know that as people are living longer, they're often living with dementia or chronic illness, and some individuals have fewer informal social supports than maybe they've had in other historical moments in history. So someone who needs long-term care needs not as much care as going to the hospital, but more than they can get by just living at home. Assisted living. In Texas, they're regulated and licensed by the Health and Human Services Commission, HHSC. This was formerly known as DADS, which is the Department of Aging and Disability Services. So if you hear people say DADS, that's the outdated, incorrect previous term for this regulatory body. Assisted livings, they provide 3 meals a day and snacks usually. Activities, they're required to have activities, assistance with those ADLs, and some basic medical care that's usually not provided by an RN. It's usually administered by CNA or LVN, which is certified nursing assistant or licensed vocational nurse. They're lower nursing license than an RN. And there in Texas are actually 3 types, A, B, and C. C is adult foster care, but I'm not going to really get into that in great detail because there's not very many of them. What you're mostly going to see is type A and type B. Basically, in a type A, the residents are a bit more independent, and in a type B, they need a bit more care. So the criteria, though, is that residents in a type A could evacuate independently if an emergency were to happen and they don't need any care during the night. And in a type B, the residents do need help evacuating in an emergency and they do need care at night. There's also large and small facilities. So this top photo that you see here is a Brookdale facility. They're one of the largest, if not the largest, long-term care providers in the country right now. And that's what you might think of when you think of assisted living. It's a big facility with a big dining hall and activity rooms, and everyone has their own independent apartment. There's also small personal care homes. This is a PBH residential care home in Grand Prairie that I used to visit as an ombudsman. And many of the assisted livings are houses like this, where there's a live-in caregiver that rotates, and there's usually between 4 to maybe 8 or 10 residents that live in the home. And there's pros and cons to both. The smaller facilities are more likely to be kind of mom and pop models, which again can be a good thing, in terms of maybe more flexibility and personalized care, not as much bureaucracy, but on the other hand, they might not have the same training or oversight or maybe even resources that some of the larger facilities have. The larger facilities, tend to be more able to offer, activities and things like that. And so I could go on about the pros and cons of both, but that's kind of the highlights of the more kind of facility type atmosphere or more, house-like atmosphere. And there's also group homes that have special licenses or certifications. So again, these would be like a house model, but there's specific ones that focus particularly on helping individuals with IDD, certain types of mental illness, or traumatic brain injuries as well. There's also unlicensed board and care homes, and I have this kind of warning signs flashing because while not all of these are problematic, the issue with these group homes is that they're not licensed, they don't have any oversight, so they don't have long-term care ombudsman visiting, which again, cliffhanger, I'll talk about in a moment what that is. And they don't have regulators from the state or anything like that, and so there's just not as many resources or protections for residents in these communities, although they tend to be a bit cheaper. And again, it's usually kind of a mom and pop model. Moving on to nursing homes. Usually there's nursing facilities which are more long-term and also in the same building as rehabilitation, skilled nursing care, and so they're sometimes called SNF for short, for skilled nursing facility. You also might hear the term medical lodge. I've seen that coming up more and more recently. They also are regulated by HHS, and people in these facilities require 24-hour skilled nursing care. This is actually a photo of the nursing home that my grandfather was in before he passed away. And you can see that there's individual rooms, but it's a bit more hospital feeling than an assisted living. Assisted living tends to feel a bit less institutional. And you can see, there's these grab bars and there's a nurse's station right here. Plenty of space for folks with wheelchairs and walkers and things like that. Like assisted living, they provide activities, meals, and there's a lot of social workers who work in nursing homes, not as typical in assisted living. But nursing home social workers often do those psychosocial assessments, providing services, even some like counseling sometimes. Advocacy for clients is a huge part of it. Care planning and also discharge planning if someone's moving back home or into the community, helping them to transition and find services for continuity of care there. So I also want to talk about memory care. Now, memory care is not its own little step here, but rather it's often an option within assisted living or nursing facilities. In assisted living in Texas, any facility that has a locked unit, meaning that if you are in this wing and you try to leave, it'll be locked or an alarm will sound, you have to have an Alzheimer's certification from the state. That requires there to be specific staffing ratios, which in assisted livings regularly, there's not a number for staffing ratios. It's just you need to meet their needs and whatever that means. So there's staffing ratios that if a facility has more than 17 residents, they need to have at least 2 staff. And they also have additional staff training. Now it's only 4 hours for regular staff and 6 hours for activity directors, but it's better than nothing. And if, again, they have 17 or more residents, they need to have an activity director employed at least 20 hours a week, providing a range of activities. In nursing homes, there are some that have Alzheimer's certification, but the vast majority, again, in Texas and in the Dallas area, are just locked units. Now, the facility themselves might provide additional training or have standards internally as far as policy, but legally in Texas, you can market yourself in a nursing home, not assisted living, in a nursing home as memory care, and all you have to do is slap a lock on the door. So I encourage people, if they're considering this option for themselves or a loved one, to look at what does that mean that you have memory care? Do they have an Alzheimer's certification? It's a separate license that should be posted in the building. And if it's just a locked unit, how is that providing additional quality of life and services to your loved one other than just, preventing elopement from the facility? This is a map of the assisted living and nursing facilities in Dallas County as of a few years ago when I was a long-term care ombudsman. I made this, and you can see there's a lot. At the time that I transitioned from the senior source to UTA, there were 75 nursing homes and 240 assisted livings, something like that. So there's a lot of options, and it's continuing to grow. There's also CCRCs, which is Continuing Care Retirement Communities, also known as Lifecare communities. They include independent living, assisted living, memory care, and nursing, kind of all lumped into one. Well, not all lumped into one, but different levels of care provided in the same community. So maybe, the top level is independent living, and then the next level is assisted living, and the next level is memory care, and the next level is nursing home care. And so the idea, or maybe they're different buildings on the same campus, and the idea is that you can age in place and move, from one to the next without as much disruption. So moving on, we have long-term acute care hospitals, which, depending on who you talk to, may or may not be lumped into the same category as long-term care, but they are for really medically complex cases. Often someone might have traumatic brain injury or a ventilator or something like that might not be able to be treated in a nursing facility or other community. Patient often requires 24-hour-a-day hospital services and intensive intervention from a physician, and it's usually following being discharged from a short-term acute care hospital or STAC. So we have LTAC and STAC, and they average about 18 to 35 days. So this is long-term compared to a hospital, but shorter term than a community setting. So for the purposes of this lecture, let me just digress a bit in terms of language. Community is often used to describe being in a home, as in not an institutional facility. But long-term workers and residents and family and advocates alike are trying to move away from the language of facility. I know I've said that several times, and that's really just to distinguish that from being at home in the community. But the term community is often used to describe like an assisted living instead of an assisted living facility. It's, our community, people in this community, moving to that community. I like that language more, actually, and I think it's great to move towards community and not facility. But I've used facility still just for the sake of clarity in this. Some policy considerations to think about is how are we going to provide long-term care and other related services for a rapidly growing aging population? And how do we ensure that that's quality care in terms of oversight and advocacy and make sure everyone's being treated well? We also need to think about how people are paying for care. And again, it wasn't within the scope of this to go into a lot of detail about the cost of each of these, and it really depends on the situation. But bottom line is these are expensive, and some of them are unbelievably expensive. When I worked as an ombudsman, I covered assisted livings that were $2,000 a month all the way to $12,000 a month private pay. So it can be quite expensive. Medicare covers some of these services. Medicaid covers some of these services. Medical insurance or long-term care insurance covers some of these. And VA, Veterans Administration benefits, covers some of these. So again, there's nuances to which take Medicare, which take Medicaid, where you can do that. It's different for each of these levels. And maybe I'll get into that in more detail in another video, but there's several different funding sources, and often people have a hard time paying for this care. So overall, there's a lot of different options, both in-home and in residential communities. And there's concerns about how we're going to fund it, how we're going to get enough qualified and caring and competent workers, and also providing oversight to this industry. I'm ending with talking about the long-term care ombudsman. I've been teasing you with this all along, and they are a resource for people in long-term care communities. We're actually mandated by the Older Americans Act, and they protect resident rights. And so they make regular unannounced facility visits to assisted livings and nursing homes in Texas. Their ombudsmen are all over the country, but in Texas we visit assisted living and nursing homes. And I keep saying I'm not an ombudsman anymore. I was a certified ombudsman for many years. They receive and investigate and work towards the resolution of complaints at facilities in regards to quality of care, quality of life, really anything that has to do with life at the facility. They also educate facility staff on resident care and best practices. So they'll do free trainings on abuse, neglect, dementia, and helping family members navigate the process of choosing a facility. They're, in my opinion, the best unbiased, free source of up-to-date, accurate information about these communities. They can't necessarily recommend a community because they're independent from each of them, but they can help describe, common complaints at communities, what it's like, what the residents are like there, and help gear someone in the direction of what facility might I afford or different things like that. So they're a great resource. Usually, the long-term care ombudsman office is housed out of the local area agency on aging. In Dallas, it's through a great nonprofit called the Senior Source. So I would encourage you to check out to an ombudsman if you have more detailed questions about any of these. Thank you for watching and hope this was helpful.